This patient, the MRI you see here on this 80-year-old lady, she came to see me after 2.5 weeks of pain. She has a compression fracture. She has a compression fracture of T11. You can see by the loss of vertebral height, the vertebrae above and below are very square. The one in the middle is squashed down to a point of almost 50% of height. There's a whiteness in there which denotes edema and blood and bleeding within it, which is picked up by the MRI. There's a small fragment of bone in the front, and the backside is actually relatively smooth. This next MRI shows a similar thing, a little close up, which shows the vertebral body. The squashed one is, as you would say in layman's terms, with the whiteness in it, which denotes a recent fracture. I saw it in 1999. It became a viable entity, and I've done probably 500 of these cases. Once the patient is placed on the table in a prone position on her stomach, under fluoroscopic control, a needle is placed into the vertebral body through an access was totally within bone, away from the spinal cord, away from the spinal canal, and away from the spinal nerves. And following that, a balloon is placed, which is shown by the dark spot. That balloon is filled with a material that is radio opaque, and it shows how much can be inflated in the damaged vertebra. Once this is inflated up to a certain amount, it's removed, and the same space, the void that's created, is filled with a liquid cement that's a very doughy consistency, so it doesn't run off anywhere. And several applications of this doughy cement are applied so the space is completely filled in, restoring the integrity of the vertebra and making the pain go away. This is a close-up of the cement in place, and you can see the outlines of the vertebra on the left side and a little bit on the right where the cement has filled in the area where the fracture occurred, which is replacing the fractured bone, stabilizing it so pain is gone. Is 99% of these people do extremely well. The fracture is elevated, a biopsy is done, the cement is placed, it stabilizes the fracture, and the pain goes away. It resolves the constipation, it resolves the back pain, it resolves the deformity, it resolves the lung compression, which is like 9% of forced vital capacity in anybody over 60 or 70 years of age in the lung. So it seems to work very well. There's a 5-fold increased chance of another fracture at another level in those people with very poor bone density. Half the patients that have these fractures do not have to fall down. They can reach over and tie their shoes if the bone density is poor. In the end, it restores people to a good functional level. Physical therapy helps a great deal to restore confidence, and I usually don't see anybody back after the first or second visit.